ashver.com.
Hello and welcome to ashver.com. You are watching an interesting video on how to recognize the signs of pregnancy while breastfeeding, common pregnancy signs while breastfeeding.
Please read the disclaimer carefully.
There is a prevailing belief that one is unlikely to get pregnant while still breastfeeding. Breastfeeding does reduce a woman's fertility, but it does not prevent pregnancy. Breastfeeding has been used by many mothers as a natural contraceptive method. Termed as lactational amenorrhea method, LAM, it is effective only in certain conditions. These are: the infant is exclusively breastfed. The infant is not more than 6 months old. The infant breastfeeds more than 6 times a day. Each breastfeeding session lasts at least 15 minutes. The mother is still amenorrheic, no menstrual flow since. Breastfeeding stimulates the hormone prolactin, which has a negative effect on the reproductive hormones. The higher the prolactin levels in the body, the less fertile one becomes. Prolactin restricts ovulation and prevents menstrual flow. Its levels are highest at night, between 1 a.m. to 6 a.m. More nighttime feedings further increase prolactin levels. Some mothers successfully stay unfertile for up to 16 months by increasing their prolactin levels. Even if the above conditions have been met, it is still not a 100% effective contraceptive method. Most women may become pregnant once their menstrual flow resumes. The first period is often anovulatory, meaning there is no fertile egg released from the ovaries. However, it is also possible to ovulate without any menstrual flow. The longer one remains amenorrheic, the more likely it is to ovulate without any menstrual flow. In both cases, one can get. It is often held that breastfeeding makes pregnancy unlikely because oxytocin makes the woman's reproductive tract unsuitable for a growing embryo. Oxytocin is also one of the hormones that stimulate lactation. The uterus is thought to be contracted and unable to allow implantation and growth of an embryo. Contrary to this belief, the uterus is only sensitive to the effects of oxytocin in the 24th week of pregnancy. The breasts become more tender than usual. Pregnancy hormones can cause the breast to be more tender. There is increased nipple sensitivity. The nipples may appear sore and more irritated. At this point, take better care of the nipples. Avoid the use of harsh soaps as this can cause dryness and further irritation. Apply lanolin cream to moisturize, relieve soreness, and prevent cracks. It is best to air dry nipples or pat dry with a soft towel. Milk production decreases. As the pregnancy hormones increase, the prolactin and oxytocin levels dwindle. The milk production starts to decrease. Milk quality changes. The breast milk begins to change in quality, usually by the 3rd week of pregnancy. The milk tastes more sour or saltier. The breastfeeding child may complain of a different taste. Breast milk becomes more watery in consistency and less white in color. By the 2nd trimester, the breast milk reverts to colostrum. The mother may observe decreased desire to feed, or the child seems unsatisfied with breastfeeding and may need more supplemental feedings. Weaning may naturally occur at this point, as the child becomes less filled and satisfied with breastfeeding. Implantation bleeding. This is one of the common signs of pregnancy while breastfeeding. This is spotting or slight bleeding caused by the implantation of the embryo into the uterine wall. It usually appears between the 6th and 12th weeks of pregnancy. Nausea and vomiting. Morning sickness is most notable during the first trimester of pregnancy. Certain food taste and aroma can trigger nausea and vomiting. Most women report intolerance to fish. Smelling citrusy scents can help alleviate the feelings. Make sure to get enough nutrients even with the discomfort of nausea and vomiting. Eat less carbohydrate-rich food and more proteins at this stage. Easy fatigability. Breastfeeding already strains the body of energy. Adding pregnancy will further decrease the mother's energy. Pregnant breastfeeding mothers may notice the need for more daytime naps than usual. There is also an overall decrease in energy throughout the day. Take more frequent naps to recharge. Eat more food that is nutritious and keep a well-balanced diet. Fruits and vegetables can help increase energy level. Most mothers are concerned about the safety of pregnancy while breastfeeding. The uterus contracts in response to the oxytocin released related to milk production. It is part of the letdown reflex in the body and may cause the uterus to contract. There may be more intense Braxton Hicks contraction during the latter stages of pregnancy. Under normal circumstances, these contractions are generally safe for the fetus. Breastfeeding while pregnant may put high-risk mothers in danger of miscarriages. If the woman has a history or preterm labor, bleeding or uterine pain, it might be necessary to stop breastfeeding as a precautionary measure. If the mother is not high risk, then breastfeeding is generally safe during. There will definitely be adjustments should a woman decide to breastfeed while pregnant. Nutrition is very important. The growing fetus, the breastfeeding child, as well as the mother need to have adequate nutrition. Dietary adjustments should be made to address all of the needs of the three. Nutritional supplements like prenatal vitamins should be taken regularly. The diet should have more fruits and vegetables. Maintain an adequate balance of carbohydrates and proteins in each meal. Start with a goal of adding from 500 to 800 calories to your normal recommended dietary allowance. The 300 extra calories goes to the fetus as it grows in the uterus. Around 200 to 500 calories are needed to maintain adequate milk production. Proteins should be about 4 servings. Increase calcium as it is needed by the fetus and the breastfeeding child for growth and development, and to avoid potential problems in the mother. The fetus and the child extracts a lot of calcium from the mother's body, which could predispose her to more cramps and even hypoxia. Drink lots of water. Keep the body hydrated throughout the day. It helps combat fatigue, ensure proper body processes and needed or overall health of the fetus, child, and mother. Fatigue may be worse than in ordinary pregnancy or in simple breastfeeding. Much energy is required to maintain pregnancy and to provide adequate breast milk production. Get enough rest and eat more nutritionally dense food. The woman's nipples may become more sore than normal. Increased nipple sensitivity occurs in response to the pregnancy hormones, estrogen and progesterone. If a mother decides to breastfeed, take extra care of the nipples to reduce nipple soreness. Dryness can cause nipples to become more painful and may even lead to cracking. Apply nipple shields when breastfeeding. Dry and cracked nipples are prone to secondary bacterial infections. As the pregnancy progresses, the nipple soreness and breast tenderness may eventually abate. If the discomforts are too much to handle, weaning the child is a better idea. Try to give formula milk to supplement breast milk. If the child is able to tolerate solid foods, increase these with each feedings. Emotional attachment may become a problem. Deal with tantrums or any negative reactions towards weaning in a loving manner. Always assure a child of parental love. Engage in other bonding activities to let the child feel less neglected, and feel. Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find a lot of interesting videos on wide range of topics here. Stay tuned and keep watching.